Okay, well, welcome everyone, and thank you for joining our webinar, Success with Real-Time Data Part 2. I am Ed Shen. I'm the CEO and co-founder of Quality Reviews, and it is my distinct pleasure to introduce you to Lori Turner, who is the Chief Marketing, Experience, and Innovation Officer at Beacon Health System in South Bend, Indiana. We have been working with Lori and her team at Beacon for the better part of 2 years now on their journey with real-time feedback and improving the human experience. So before we get started, I just wanted to point out some housekeeping tips. There is a chat box, but if you also wanted to type in your questions, there's a separate Q&A box, so please feel free to go ahead and type in your questions as Lori is speaking. So without further ado, I turn it over to you, Lori.
Thanks, Ed, for having me, and thanks for the opportunity to share some of what's going on here at Beacon. We've had a really interesting journey, and I'm going to run through some slides now and look forward to some dialogue, not only to share what we're doing, but to hear about what else is going on. So thank you, Ed, for inviting me to participate in this. So, we have a number of things to talk about. It was on the first slide, so I'm going to kind of jump in sort of to our first topic, which is that I have at the top of the slide, you are invited, because we actually took a very deliberate approach when we went down this journey to not make it so this is what sort of the home office or what corporate's telling us to do. So we really used more of a ground up kind of philosophy in terms of how we rolled it out when we started our testing, which was about 2 years ago in mid-2017. So I really started with one part-time staff member on this, and we put together a 15-member cross-functional team. So that's made up of operators, clinicians, from all areas of our system, which we did that kind of out of necessity because we didn't have staff, but honestly, I think it was the best way to do it in retrospect, because we ended up being able to operationalize things and I think had a richer, better product earlier because we got so many things involved. We also, when we did this initially, part of the challenge in looking at Press Ganey data, we use Press Ganey for HCAHPS data, was that I didn't really have any line of sight as experience officer for Beacon to my outpatient visits or my office visits, which were, just the Beacon Medical Group office visits are alone are probably approaching 800,000. So I felt like I didn't have enough